when we go to buy a shirt remains the same, but it's just you are choosing different brands as you like. In the same way, any hair transplant basically has just two steps. One is harvesting of the graft and the other is implantation of the graft. Now how you harvest is kind of same across all the treatment options because
you have manual punches, motorized, and you have robots. So explain a little more about that.
Yeah, so most of the times we use what are motorized punches. There are different punches available in it. It takes a cylinder of
the different equipments will come with how the quality of the graft. It also depends on the surgeon who's using the equipment. So it's not just tool alone. Just because you have the tool. Tell the basic, what a patient needs to know, the basic of hair transplant. So just explain to them, forget about the brands, the basic steps of hair transplant. So basically, I want you to explain to them, the viewers, what is the two important steps in hair transplant and the variation in the steps that carries names.
So Dr. Jayanti would very classically put, when we go to buy a shirt remains the same, but it's just you are choosing different brands as you like. It may be Van Heusen or Alan Solly.
Correct.
In the same way, any hair transplant basically has just two steps. One is harvesting of the graft and the other is implantation of the graft. Now how you harvest is kind of same across all the treatment options because you use the same punch. If you're doing FUE, the punch remains the same. There are different types of punches available, but you will use a basic punch to harvest the graft. But
I'll interrupt here. So I'm just going to add a little bit here. So what Dr. Anish means by punches, so the differentiating factor is you're removing a follicular unit from specific parts of your body where we understand will not be affected by the hormonal influence. So like the side and the back of your scalp or the beard or some part of the body. Now, how these follicles are harvested, that is what he refers to be as a punch, right? You punch and take, so you're not cutting anything, you're not using a blade, but you're using a punch which is helping you to remove that. Even in that, right, you have manual punches, motorized, and you have robots. So explain a little more about that.
Yeah, so most of the times we use what are motorized punches. There are different punches available in it. It takes a cylinder of tissue along with the hair and the tissue around the root of the hair together as a single follicular unit. And similarly, robotic installations are also available which can help you harvest hair from these specific areas.
Yeah, so again here I would like to come in and help you all understand in depth what this is all about. This is like, let's say now we are talking about punching and removing a follicular unit.
Yes.
This and how this punch is removal of the follicular unit is done is like, again, the equipment is like you wanting to buy a car. It could be a Maruti, it could be a Hyundai, it could be an Audi. So you have different types of medical equipments even in this punches. And believe me, so these are not against. Why does somebody buy a Maruti? Why does somebody buy an Audi? It's just not just status symbol in all that case. Of course, when it comes with certain features, safety mechanisms, etc. The same thing translating to punches here. The different equipments will come with how the quality of the graft. It also depends on the surgeon who's using the equipment. So it's not just tool alone. Just because you have the tool, it's not that you're going to get a better result. Coming to robots. So you know there are various robots that are available today. Partially automated, fully automated robots are coming for use in healthcare. Now what does these robots do is they are trying to automate the process which the surgeon is doing. That does not necessarily in all the time mean that the results are superior. It may be beneficial for the surgeon in some way because it reduces surgeon's actual time in the theatre. That was an advantage when it comes to certain procedures. Whereas in some other procedures, it actually improves the quality of life. When you talk about robotic surgery in abdomen surgery, so they are all very different because you're not trying to manipulate too many tissues. Here it is different. So let's talk about the punches. So you have different punches. And that's again where your cost for surgery differs, because let's say a clinic is deploying a specific equipment for harvesting your follicle, and obviously you have these motorized punches varying from a couple of thousands, 20-30 thousands to 7-10 lakhs, and the robots are few crores. So please see the vast difference in prices. It's similar to you buying a car. right? Maruti, Hyundai, whatever it is. You have to understand this in healthcare, right? These kind of different equipments, why it is used? Because you get grafts most of the time with better quality, the surrounding peripapillary tissue is not damaged. A very very skilled surgeon can execute the same with even a manual punch. That's what I'm trying to tell you. But the procedure can be slowed. You might be able to do only less number of grafts in a day. Suppose you use a better machine and the surgeon is skilled, you will be able to do more number of grafts in a shorter span of time, less exhausting for you, more comfortable. Now robots are coming into the picture. There are different generations of these robots have come into the market. Initially it was only for harvesting, then it was for making slits. But then again it will depend on whether that particular surgeon is following that technique.
Correct.
Because in Tamira, we don't follow making slits. We do what is called a stick and place method, not a slit and place method. So now this is with regards to harvesting. Now I want you to also explain a little bit on what actually decides the graft survival. Very very important, for because people think that if you hear one word, that specific brand name, that depends on your best results. So it's very important you tell them what actually decides the results.
The first thing, as you said, using the right punch, using the right speed and the right precision to take out the graft so that the peripapillary stem cells, everything along with the tissue is intact. That will ensure that as soon as the graft comes out, it doesn't dry and desiccate. Then immediately once it comes out, you need to store it in a storing medium. It has to be cold. It may be included along with PRP or other growth factors to ensure that the survival is there. Then you prepare the graft. Once the grafts are prepared, you make sure that within a certain period, preferably within 3 to 4 hours, we would want the grafts to go back again into the scalp or the implantation process to get completed. So most importantly, these are the factors. One is how the grafts have been taken, as less handling as possible while during the process of preparing the graft, then storing the graft in a good medium and in a cold temperature, using growth factors or PRP to add to the survival rate, and to make sure that within 3 to 4 hours we place it back again into the scalp.
From the time it is harvested.
Yes.
So that's why you would have heard of a terminology saying that you can harvest and implant at the same time, right? But it is not essential that you have to harvest and implant at the same time, because then if the angulation is wrong, then you will not have a geometrical placement of the graft. So you have to harvest fast. The graft can survive outside of your scalp 2 to 3 hours, and in some special medium even there are literature papers saying they can be stored for 6 hours, but at the shortest as possible. But the key here is the graft being harvested without damage to the peripapillary cells. So I tell everybody, when you go to a salon and you cut your hair, it doesn't hurt. So the external hair that you see outside does not have any life. When you pull your hair, it actually hurts because it is attached to, let's say, like a cup, a peripapillary area, which is actually connected to your neurovascular bundle. So when you pull that area gets pulled. So you might have read that when somebody who had long hair met with an accident, the whole scalp is avulsed, right? So that strong is the attachment of the hair to the roots. So if your bunch of hair is pulled, your whole scalp can actually get avulsed. So you must understand. So many people, when you wash your hair, when you comb, when your hair is falling, it clearly means that they are not attached to the root. You need to understand that. If they are attached to the root, they will not fall. So it's very, very important that you understand all of this. So the graft is the most important to determine the result is how the graft is harvested with the surrounding peripapillary cells and how less it is handled and it is put back. Now tell us, I'm sure the different techniques of how it is inserted back into the scalp. So probably you want to just give them a different technique and how they understand.
So what we do is called a stick and place method. In this we use a very small needle, like how we take for blood samples, and depending on the size of the graft, it can be a single follicle, it can be 2 follicles or 3 follicles, we will choose the needle size. And depending on where we want to insert, we can use the appropriate needle and give the right angulation and the right depth of insertion. That is the standard stick and place. The advantages are that because we are using a very small needle, you would notice that you never get a scar with a needle or a pinprick during the blood sample. In the same way, when we use a stick and place method, the grafts can be placed pretty close because the holes are very near, and also the scars that are formed subsequently will be less. So
Yeah.
that is the advantage, because we notice when people do what is a slit in place, because the slits are very big, especially in the front of the scalp, the scars can be very prominent.
When you remove the graft, if you just go and type FUE follicles in the Google, it will show you how your grafts will appear. You can have grafts which are just single, you can have grafts which are two, and they are follicular units. So single hair follicular units, double hair follicular units, triple hair follicular units, and even 4 hair follicular units. Now they all vary in size. So let's say when you're actually making a pre-made slit and then you're inserting, you're actually going to make, because after you make a slit, you can't identify that you have made smaller slits here, and then you're going to put all ones, all twos, like that. So when you make the slits, which is the length and width of the biggest graft, and then when you insert smaller grafts, the chance that likely that they can fall off, or the slit size are more, and sometimes when it's not done, of course there are skilled surgeons who do them well, but when it's not done appropriately, the slit is made and the graft is inserted at a different depth. That's when you see what is called the cobblestone. So this is commonly seen in the front, and people come and ask us to get that removed, and it's not so very easy to get that sorted out. So this is something you need to know when we are placing. So there are all the other different names that you hear are different type of equipments that are used to make these slips. So it's whether they may use a needle, or you make a bleed, or you make a specialized blade, whether it's a sapphire blade or a diamond blade or whatever it is, right? They are all just blades that are used, and why they are used is because the slits could be more precise. So obviously there is an advantage of the type of slits that are used, but it all depends on the surgeon who's doing your procedure, and it doesn't depend on one particular word. Just because someone says I am doing so and so technique, that doesn't mean that everywhere that technique is done you get a better result. So don't get carried away by this name, which is very, very important for you when it comes to hair transplant. The next important thing that you need to understand in hair transplant is the anesthesia. Now talk a little more about the anesthesia that we do, why it is the most crucial step, because this is where most of the complication happens. This is why you need a board certified medical specialist, especially a plastic surgeon or a trained dermatologist with an anesthetist doing the procedure. Yeah.
So we